Here we are sharing a small technical point while making the Boari flap. Normally in Boari flap, bladder will be distended like this and ureter will be here. When the bladder flap is made, we make the flap like this. We usually distend and cut like this and then cut like this. When the bladder gets emptied, this shrinks and you will overestimate this length and ultimately flap may come small like this. Then this breadth may go. Instead of that, point we are sharing here is distend the bladder. This is the ureter and make the marking same. Make the marking according to the ratio. This breadth versus this, make the ratio. But while cutting, after the marking here, while cutting, you start from here with scissor, not cautery, and make this U, not V. And then you pull this tissue back, see inside the bladder and keep on going laterally like this. Then bladder base will never get contracted and become small, and that mistake will never happen. If this becomes small, this flap may not be viable. So very important point is hold it, pull it back. Seeing the bladder, you cut reverse cut with hook here and there so that you can see nice breadth of the bladder from inside. Sharing the video. See here, it's a full bladder here. We are distending, we are marking here. This only for this marking we use the cautery. We don't cut at the base and open the bladder because after that it collapses and then retrosar contracts. So here we will not open. Here just we will mark it on both the sides. Now we take the scissor. Don't cut here, we don't open. At the tip here we will open. After that everything collapses. Now we will make see, we are pulling and then we will make with scissor only. Whatever may be the bleeding, we don't use the cautery there. See, horizontally we cut. With this tip also breadth will be more. Now I am pulling back. See, automatically you are seeing the bladder, and with hook or any instrument you pull it up and make a wide base. See here also with hook, you can use scissor, you can use the hook, no problem. See, wide base has come. The chances of any loss of the bladder base, which is disaster, will not happen in this technique. Even though it is a small point, our last 3-5 cases, we felt that this is useful. So now we are closing the bladder. Rest of the thing is same. By keeping the breadth at the base, there are a lot of advantages. Only bladder capacity may come less, but ideally our ratio has to be maintained. For that, you should never make the base of the flap narrow. If that is narrowed, if by chance any flap ischemia comes, then entire bladder goes waste. So one should be careful. There is nothing new here. If you use ureteric catheter and make properly, but if you open the bladder, there is chance of the retrosar retracting, and while you are cutting, you will not be clear where you are going. So now the technique of the ureter to the Boari flap suturing is same. First apex bite we are taking here. After that you lift in the air and then close it, and then this is the suprapubic region just above the clitoris. The port is kept so that it will easily kept. This stent is also placed. Now rest of the bladder is closed. One more important is mucosa eversion here. 2-3 stitches is useful so that the retrosar muscle can be taken. These are the triangular stitch at the apex that closes without any gap. So this is the point we wanted to tell. If you pull the tip and then pull back towards you, bladder base will come nicely is the point. Here tension free anastomosis has come. Marking and principles of ratio breadth to length is same. Only thing is that to avoid mistake at the base level, we will cut the tip with scissor. After that we will pull it so that we can see inside the bladder, and then see the breadth, and then cut the flap on either side as lateral as possible. So this is the play, and after distension no leak. Thank you.